So good afternoon if you've just joined us. Welcome to the ExChange Autumn Conference Series, Safeguarding Approaches to Criminally Exploited Children. So this is our last in this particular series. This conference series began on the 1st of October with a recorded address by Dawn Bowden, the Minister for Children and Social Care in Wales. For those of you who are just joining for this session, all of the previous sessions are available. You can access the recording on the ExChange website. So today's webinar is from Sarah Goff from Manchester Metropolitan University, and she's going to be talking about the exploitation of learning disabled and neurodivergent children. And I understand that this webinar draws on findings from a study that she undertook with her colleagues in England and in Wales, which examined the risks of modern slavery in relation to children and young people with special educational needs and disabilities. The format that we're going to follow is that Sarah's going to speak for 35 to 40 minutes, and then we should have about 20 minutes for questions and answers. So please do post your questions in the chat box as we go along. And then at the end, I'll try and ask Sarah as many questions as possible. So thank you very much, Sarah. Over to you.
Okay, I should start off by saying Bore and Diolch. Thank you. Thank you very much for inviting me to come and speak today. And I'm going to be presenting this presentation from some work that we did at Manchester Metropolitan University. And my background, just to explain, is as a social worker, and I worked for many, many years in practice. And I think perhaps it was starting as a residential social worker in the middle of the 80s, working with children that were described as on the game, which was a horrifying concept. Being exploited is not a game in any way. And that awful, casual, dismissive language, which problematized children, for me in my very early 20s, was perhaps my first awakening to the exploitation of children. So I went on to train as a social worker, and I now am a researcher at Manchester Met. And I'm doing a doctorate looking at communication in Section 47 child protection inquiries when learning disabled and neurodivergent children are sexually abused or exploited. I chair the National Working Group for England Non-Safeguarding Disabled Children and a similar group for BASWA and a group, the Association of Child Protection Professionals. There's a lot of commitment, isn't there, to improving practice. And as a social worker and as a researcher, I hope this presentation is just part of a useful conversation. None of us are expert, all of us are learning, and I think this group of children are often very problematized and pathologized, and it's important to focus on them. So thank you for asking us. It's really great part of this excellent series of seminars that you've done and the really valuable work that's been done in Wales and by Nina and her colleagues. So thank you. This title of this presentation, by the way, is called Falling Through the Net. And it was called that because of the extent to which these children get missed, both at the point of prevention, at the point of their rights as ordinary children growing up to services, and for their rights for protection, which get misunderstood. I've put the links to this study, and I'm sure that Sian and Charlotte and colleagues will point people in the right directions if they can't locate it. My email's at the end of the presentation. It's s.goff@mmu.ac.uk. You are welcome, if you want more information, to email, or if you want to comment or share thoughts. But our study was carried out when our team was based at the University of Portsmouth. We've moved since to Manchester Met. It was led by Anita Franklin, and it was funded by the Modern Slavery, Human Rights, Policy and Evidence Centre. And along with the Centre for Sexual Abuse, the CSA Centre, the Modern Slavery PEC has lots of really relevant reports. And for those of you in practice, as well as those of you who are studying or researching, these reports produced by the CSA Centre and the Modern Slavery Human Rights PEC are really helpful contributions to understandings of the challenges of multi-agency practice for all sexually exploited and abused children. And in talking about this particular study, I'm very conscious of the overall dynamics of over-reliance on children to tell their story, the failure to pick up sexual abuse, the fact that children try many times to tell us, that for children across the board, all children, there are huge issues in terms of relationship safety and sexual safety, both on and offline. And there are massive issues for their parents. And working with those parents as a resource for protection is something we're trying to do across the board. But this study will talk about the issues of identification and response to children and their parents, specifically for those who have special educational needs and disabilities and who are neurodivergent. Now, I'm going to be using terminology that we don't necessarily like. We see SEND, the special educational needs and disabilities, as a bit of a deficit term. We much prefer within our work to refer using social model language to disabled children and young people, because they are disabled by lack of the right systems, by lack of access to those systems, and by lack of the right support. But we had to use the terminology used by the government and the Human Rights PEC. That will reflect a bit in some language throughout what I'm talking about, and I, hope people are okay with that. Can I give a bit of context? And I've used England data just for this context. I know that in Wales, you have very different systems and different ways, and probably much better ways of counting data. But in England, over 1.7, nearly 1.8, and it probably is 1.8 now, million children have been identified as having special educational needs. And while the majority of those are young people who are or could be, should be in mainstream education, and we'll hear a bit in a minute about the huge numbers who are excluded, off-rolled or not in school, while the majority of these 1.8 million are on the books of mainstream, some of them obviously are in special schools, but only a quarter have the higher level of education and healthcare plan, which under legislation from 2014 gives a multi-agency health, education, social care plan. There are big problems with those plans. I could talk forever about that, but we haven't got time. But the reality is 3/4 of them are due to have what's called SEN support, but there are really big questions about the extent to which that support is provided, is overseen, and is available. As I said a second ago, many of this 1.8 million children may not actually be in school at all. And the Office of the Children's Commission for England identified delays of between 2 to 4, and we've heard of longer as well, but on average between 2 to 4 wait for both assessment and for speech and language therapy. Now, if we look at the needs of these children through a human rights, and I know that Wales is very strong on the children's rights agenda, if we look at their right to communicate, their right to have a voice, then delays in assessments that provide speech and language therapy, assessments to look at their cognitive, communicative, sensory, social needs, those delays disable these children. We know too, from across the board data within our contexts, our issues around social inequalities, that these children and their families face higher risks of poverty, social and school exclusion, isolation, bullying and discrimination. And from other work I do, I'm really conscious that a lot of these children have also got parents who have learning needs themselves and may have language and literacy challenges, and factors in their lives which affect their abilities to protect, and factors in their lives for which they too received inadequate support. We also know that these children are overrepresented in our care system, and the breakdown and the frequency of placement move and the reality of long distance on average from home has been highlighted, and we could talk another day about that. But the Hesley reports from children's homes in England highlighted very extreme concerns about children placed away on average 95 miles from home and without a voice and unseen. So issues of lack of empowerment and agency for this group are significant, and the majority of them are or should be in mainstream services. The question is, to what extent do they get services that fit and meet their needs? I mentioned earlier that I'm doing a professional doctorate. I'm obviously getting on a bit. I'm due to finish work soon, but my real task at the moment is my doctorate, and I'm looking at communication, and in looking at the work for my doctorate as well as all the other research we've done, and there's a number of studies that our group have done which I can send people links for if they're interested in, but it's really clear looking at the research about disabled children that they face much higher risks of neglect across all forms of abuse. Now that Jones et al. Study is old, 2012. We lack within the UK a major study of prevalence that really breaks these issues down. Getting funding for research for the safety of these children is extremely difficult. I could wax on for hours about the amount of bits we're writing and putting in. It is hard getting money to research the safety of these children. But what we do know from the work of Jones et al. And from other studies is that there is a general agreement across researchers, across international contexts, of a far higher risk, particularly of sexual abuse. And Jones et al. Identified the risks at 4.6 times greater. We know from research that is now starting to focus more specifically on neurodivergent children that they too face higher rates, and we know that they may face higher incidence of externalizing behaviours like self-harm, running away, that show us, communicate to us through their behaviour what's happening, but that doesn't mean that they can tell. And we're really clear from the work of Taylor and Franklin and other colleagues that responses to learning disabled children are less good. It takes longer for them to tell us, and the harm that they experience tends to be more severe. We know as well from the work that was begun by colleagues El Assam and Katz, and actually they've done 2 different studies, but a key point, the offline vulnerabilities, the day-to-day vulnerabilities of these children are also reflected in their online safety. And a key issue for us and the work we do is that often disabled children are more isolated, more likely to spend more time online, but they're also less likely to have had the right help and support to understand risks and be kept safe online. So higher risks of sexual abuse across the board, 2 to 4 times in the various studies I've just mentioned, longer and harsher abuse, as I just mentioned, and facing higher risks of exploitation as well as sexual abuse. The other critical thing that we identified, Franklin et al. In our systematic review 2022, and that Barron identified in 2019 in a really good study looking at the needs of children with complex disabilities, this issue of the shortage of research. This is crucial because without the research evidence, harder to get funding for services. I just want to draw your attention before I start talking about our study, if that's all right, Nina, to one more piece of previous research. And if colleagues can't find this and are interested in looking at it, I can send you a copy. This is a study that was led by Anita Franklin, Prof. Anita Franklin, who's at MMU, I work with now. This research in 2015, so 10 years ago, highlighted greater vulnerability of learning disabled children. And it highlighted some of the reasons, impairment-related factors. So about understanding of the child about what abuse is, really crucial that we're clear about the additional needs of these children for help and support to understand safety and their rights to be safe in a context where often they are more isolated, and even when they are among friendships groups, some of the research, Chatzitheory and some of the others, has highlighted greater risks of being bullied. Societal treatments, so disabilist attitudes and assumptions, a real set of issues highlighted in this study where assumptions were made that the child's presentation was linked to their disability, rather than potentially asking the right questions with an open mind. Could this child's distressed presentation be telling me that they're unhappy, unsafe, being harmed? What questions should I be asking? So that good practice issue of having an open, questioning mind doesn't necessarily get applied in the same way to disabled children, where assumptions can be made and signs and indicators of harm get attributed to the disability. And to some extent, we have to wonder about the quality, the quantity, and the scope, the breadth of the training that our colleagues in police, education, health and social care, social work receive. Is there adequate understanding amongst our practitioners and the wider community that these children, A, face higher risks, and B, it might be visible and evident in different ways, as well as in the same ways as all children? So really important study. Our study then was funded to try to identify the gaps in current law, in current policy and current guidance, and to try to understand whether that law, policy and guidance was up to date and covered the needs of children with special educational needs and disabilities. Does that policy and guidance go far enough in showing our practitioners how to respond? Secondly, it was to examine practice responses from the perspective of practitioners and parents. So to find out from practitioners and parents what they thought about practice responses, what did they see as the indicators, and how did they respond when learning disabled or neurodivergent children were trafficked or exploited. This study was looking at children trafficked and exploited internally within the UK, not from other jurisdictions. So it wasn't looking at children being brought from other countries other than within England and Wales. Thirdly, it was to consult with frontline multi-agency practitioners to better understand what they felt the barriers and facilitators were to improved practice. And fourthly, it was to develop recommendations to look at what could be done to help. In terms of methodology, and we always have to describe this really carefully so that people can see what we did look at as well as what we didn't. And what I should say is that in this study, we did not talk directly to children and young people. In the previous study, which I was just talking to you about, unprotected, overprotected, we did talk to children. And in another study more recently that we've done called Opening Conversations, we also did talk to learning disabled children and young people. This study undertook, number one, a comprehensive overview of law, policy and the guidance landscape. Secondly, we set up interviews with parents and carers of children who had a range of diagnosed and undiagnosed learning and neurodivergent needs. Thirdly, we carried out focus groups in 4 local authorities, 1 in Wales, 3 in England. And fourthly, we did 3 online multi-agency consultation events. Those were the 4 arms of this study. Overall then, within the study, we spoke to 40 different practitioners, and I think it's probably important to highlight that they were drawn from a very broad range of the services that one would expect to work with these children. So from social work and social care, so residential as well as field social work, community-based teams, from youth justice, from police, from education, from virtual schools, working with children not not in mainstream, but in alternative provision, nursing and children's mental health, drugs and alcohol workers, education psychology. We had an independent sexual violence advocate, and we had special educational needs independent advisory and support service workers from CENDIAS. The family sample was a sample of 12 with 13 children. Predominantly, they were on the neurodivergent spectrum. They were variously described by their families as being autistic or having ADHD, not terms we particularly like because it's a deficit term, but these are the terms that we used. But it's really important to stress the needs of undiagnosed. And whilst some of these children were diagnosed, some of them were not diagnosed until crisis point. This is something that we've picked up in another study that we've done with parents, which I might speak about briefly in the question and answer session at the end. But it's really important not to rely on children's having a diagnosis before we offer the right services. And that will become clear as a really significant issue in the findings of these studies. Of the 13 children, 9 were boys who'd experienced criminal and 4 were girls who'd experienced sexual exploitation. That's a difference and a gender difference that we would like to explore a lot more. Another key factor that's really relevant from this group was that predominantly they had been in mainstream, but most of these 13 children were now either excluded, they were in PRUs or alternative provision, or out of education altogether. And I think that's another really critical feature of this study that we need to consider. And perhaps if we want to take something away from this seminar, it's really reflecting on our practice in our areas in Wales. To what extent are we working to keep children in school? The other key thing from this family sample was the young age at which harm had started, but of course we could only know what the parents and practitioners told us. For all we know, for young people it may have begun earlier, but this is what they thought. So some of the key findings, the policy analysis, and we went through all of the policy and legislative material that we had and the practice guidance, and this might be a learning point for people to take away and look at their own local authority and their own single agency guidance. To what extent does it attend to the specific needs? Not just saying, because this is what we found, that most of the guidance that we looked at highlights disabled children as having additional vulnerabilities. It places the vulnerabilities within the child rather than the context around the child. And most of the guidance, apart from saying that this group face higher risks, does not support practitioners, managers and trainers in what can we do about that. So the big question coming out of the policy analysis is really looking to understand what can practice do, what should guidance be saying about how to respond. It's no good saying this is an autistic child, it's this is an autistic child, what extra work needs to happen? How do I adapt my practice? What reasonable adjustments should I be making? And those reasonable adjustments using the Equality Act may mean that I need to put more time, work in different ways, adapt my practice. So whilst that additional vulnerability was noted, there was nothing done within that guidance to really flesh out for practitioners and managers and service leaders what difference should this make to service design, service delivery, and the time and resources to be allocated. What we found was practitioners being really clear that they needed to understand both the disability and the issues around modern slavery and put the two together. And while practitioners identified that very significant proportions of the young people they were working with had learning or neurodivergent special educational needs, many of them had not had any additional training to help them with this. And so some of them maybe had a good understanding of modern slavery, some of them maybe had a good understanding of disability, but rarely had they had the chance to look at both. And what became very clear listening to these practitioners as well as to the parents was that when both of those were not understood and the interface, the overlap, then that often meant that opportunities for prevention and for early intervention were not recognised and appropriate responses were not put in place. And this was a consistent finding. So, for example, looking at the missing protocols, there are some really clear pieces of guidance about what should happen when a child goes missing. But what additional information needs to be provided when a child has got learning disabilities or is neurodivergent? How can we make return interviews, for example, more inclusive? How can we factor into those return interviews a solid understanding of what questions, what information, how do we respond to this child when we find them, when we are asking them questions, when we're talking to them, when we're trying to relate to them, and what joined up working could be implemented that isn't currently there. How do we ensure that police and social work are talking to the schools who communicate very regularly and understand maybe this child's communication assessment, communication plan? How can information be shared better? And what adjustments need to be made to the amount of time invested in planning how we speak to those children, how we respond to them? And what additional understanding should there be about them as missing children? The lack of policy and guidance meant that practitioners often had not been responding when parents were asking for help with their children when they were younger. Parents continually in this study highlighted that their requests for help when their children were younger, or more recently, or around the same time, went unheard. Too often, physical impairments were viewed as disabilities, but learning needs were not. Autism and neurodivergence were not necessarily viewed as a disability, and yet the additional help and support that those children needed were denied. So they were not recognised as disabled, but their needs were not met. Their needs went unheard. And the data illustrated quite a clear pathway. So undiagnosed, unrecognised by services, not getting the right speech, language, communication, behavioural, sensory support when they were small, moving on through school, starting to get labelled, transitions becoming difficult, starting to feel isolated, and transition to big school, often a crunch point where things were beginning to break down. But actually, these are children like all other children. They want friends. They struggle much more to make relationships and feel safe within groups. But if those needs go unmet and unheard, then we have very children who have been made vulnerable and isolated within a service. The other thing that was apparent from what practitioners told us going on alongside the journey of the child was that there were less and less support staff for teachers to use and for SENCOs to draw on, special educational needs coordinators to draw on to work with these children. In England, certainly the school nurses who used to be very much more visible, available and present within schools are now not available just to one school, but one school nurse sharing 6 schools. Their time to be involved and attend planning and support the social and emotional well-being of children much, much reduced. Lack of education welfare picking up on school absences and lack of social work time to build those direct relationships to work well with these children. So there's gaps and missed opportunities all the way through the child's life in terms of the services they need as they're developing, but there's also the current impact of service changes and service closures. And that has led to a situation where the parents and practitioners were describing the words used to describe children with special educational needs as disruptive, naughty, challenging, difficult. And that negative disablist approach, based on not understanding those rights and needs of those children, can lead to punitive and isolating approaches towards those children who are getting short-term fixed exclusions and ultimately school breakdowns. And one of the social workers talking about her caseload said, if you went back through nearly all of our cases, and this was of sexually exploited children, you will see a pattern of breakdown in education placement, whether that's once and it's resolved or whether that's multiple times and they end up ultimately completely excluded. She was very clear. I don't think we need to underestimate how powerful it is to keep our children in school and how we should go to, the ends of the earth to make sure that they stay there. I think one of the other things within school was that every child is different. And one parent described her child, who was actually very bright, but was always being regarded as a problem. She said two things that enormously contributed to his exploitation were, one, that he was clever, but at the same time constantly academically failing, and secondly, that he was kind of othered. He was seen as the problem. The school just regarded him as being a problem, not having a problem. For others, there's the misperception and the belief that sexual abuse, exploitation wouldn't happen to a disabled child. And some of you might remember a report back in 2003 from the National Working Group on Safeguarding Disabled Children, called It Doesn't Happen to Disabled Children. And this practitioner was saying that this belief is still around. There's still a belief that these children with special educational needs or disabilities are not going to be exploited. And that's such a major misperception. One of the other practitioners had been chairing placement disruption planning meetings for children at high risk of criminal exploitation, and noted that in the previous week, back to back, 3 meetings that she'd held were all of a kind. They were all 14-year-old boys. They were all excluded from school. They were all described as having a spectrum or autism-related need, and every single one of them were not in an appropriate education placement. This worker was really concerned because not only were these 3 lads all in separate situations, not in the right placements, but also their parents weren't necessarily equipped and supported to respond. And I'll say a bit more about that in the question and answers if we get time, because we've done some more work on that issue. But the question of both school and parent not being in a position to respond. Another person talked about a child who'd never felt like he'd belonged. He was isolated, he wanted friends. He's now got friends, they've all got very similar things. But it was a friendship group that doesn't understand that they were all being exploited. They don't see it as exploitation, they just see it as helping their friends. Isolation is a really, really common theme throughout the abuse of disabled children. And those issues are really a strong thread all the way through this study and the other work we've done. Constant placement changes for our young people and the lack of stability. They'll have placement breakdowns, and we have to look at the extent and quality of proper support around the learning, communication, language and neurodivergent needs in a placement to set it up from the beginning to be strong. What was really clear from a lot of the practitioners was that placement breakdown was a really frequent issue for these children. So initially there'd be a local placement, but then school breaks down, they're not in school, and then they end up moved to different placements. And for this worker, she was talking about children out of education, not in school, and they're on the streets, they're easy pickings. And we know this for all children, but this is much more common for children with learning disabilities. And both the practitioners and the parents saw remaining engaged in school as the most significant factor in keeping children safe from modern slavery. I think we would probably say that it's a combination of being engaged in school and having a stable home or care placement. But opportunities were being missed for schools to be a protective factor. Breakdowns need to be seen as an opportunity for intervention. We need pre-breakdown multi-agency planning. And that was something that we were not hearing about, that things were starting to get difficult, the child was seen as a problem, and fairly soon that escalated into exclusion. And what we want to see is some intervention that anticipates that initial signs of breakdown in school and immediately gets in there to really put some strong planning around to prevent a total breakdown. We were very conscious listening to education colleagues of how stretched their resources, and we were very conscious of the need for those to be multi-agency issues. There was another critical issue that was highlighted by one parent, which was almost about a breakdown between school and social care to the point where they'd got this child finally back into school. There'd been lots and lots of problems. He was always being sent home, and getting him into school was really, really difficult. But he ended up being in trouble for not wearing the right jumper. The effort that parents and workers had made to get him into school was then met with absolute frustration when he was sent home for not having the right jumper. And for this child, it was a vicious cycle for pretty much 2 years. We kept saying he needs to be tested, assessed. 4th year of secondary school, constant pattern where he kept being sent home for stuff that wasn't great, but it wasn't a big step away from where we'd ended up. He'd splash water at somebody, he wouldn't wear his jumper, he was being boisterous. But he ended up faced with either permanent exclusion or alternative provision. And once he was moved to the alternative provision, he went from being a mischievous lad full of beans to actually getting drawn in to being fully exploited, starting to go around with groups, really drawn in, starting to steal cars and disappearing for long periods. It was so important to have not let that breakdown happen. Just one quick example of a composite state case study. And it's anonymised, and it's just to give you a bit of a sense of the typical journeys of some of the families. Family asked for help with their daughter. This parent had been asking for help with her since primary school. They'd asked for help with communication and language. They'd recognised she was isolated. They'd seen her as distressed in school. They got no response to repeated requests from a number of services. But the parent felt that school were thinking that she was the problem. This child then transitioned up to secondary school, and her distress, her presentation as isolated but wanting friends, increased. Not long afterwards, a parent found explicit images on her laptop which appeared to be sent from an older male. This was referred to the police. Nothing was done. Social work therefore did not remain involved. This child, now in secondary school, all this has happened, but there is no continued social work involvement. She starts missing lessons. School doesn't let parent know. Child's just seen as a bit difficult and as a problem. But when the parents find out that she's been missing lessons and school haven't kept them informed, the relationships break down. Finally, after years and years, a diagnosis of autism is made, and this young person by then was seen as having mental health problems. Despite the diagnosis, little actual direct support was offered. This child carries on in and out of school, but starts self-harming, going missing more often, and starts being on the fringes of using substances. She increasingly links up to older young people and starts to get into more and more serious situations, coming home with injuries, coming home distressed, coming home after being missing. Finally, a police ABE interview is planned, achieving best evidence interview. However, Mum asked for a special intermediary, asked for special planning, explained her daughter's communication needs. And despite this, the interview was cancelled at short notice. And despite this, no intermediary was ever provided. This situation remained really critical and serious at the point we were talking. So, what are the lessons? We need to respond earlier. We need to respond well. Responding earlier is about picking up much earlier signs that a child is isolated and distressed, and it's about listening much, much earlier to parents and taking them seriously and not seeing them as the focus of concern. The parents clearly wanted to be supported and seen as a resource of protection. Secondly, parents' frustration. We need to understand better the cumulative effects on parents of years of having to fight and ask for help and feeling frustrated. We need to continually question presumptions that the issues are home-based, and we need to understand much, much better the journey of neurodivergent and learning disabled children. We need to question the safety of their friendships outside the home contexts and our ability to understand parents. The other key thing parents said was that for neurodivergent learning disabled children, they need consistent workers. And in one case, a parent finally was allocated a worker to come and work with her child, but that child needed a consistent worker. And she related really well to a worker that came, but then she left. This parent was really clear. This child would have benefited could we have kept that worker consistent. Now, I know we talk about worker change across all agencies, and that's deeply frustrating. But I think a reasonable adjustment under the Equality Act is recognising that it's much harder for these children to cope with change. We need to work harder for consistency of worker with these children. So the key message was too little, too late. And you will all be very aware of the devastating impact that exploitation has on children, young people and their families. You can look at this list and you will know many, many cases that have experienced this. But the key message here is that if we could have listened earlier, if those other services could have been put in more soon, and if we could have made more reasonable adjustments and listened to what parents were saying about their child rather than seeing the child as the parent as the focus for concern, then perhaps we could have done more to prevent what is additional level of risk to these children. We also talked to parents, and I haven't got time to go into much more detail here today, but we talked about the wider implications for the whole family and for siblings. And I think one of the things we need to remember with neurodivergent learning disabled children is that they're quite likely to have siblings and parents themselves who've got extra needs, and be really conscious about the impact of trauma on not just the index child, but the whole family. The families were really clear that good practice was about a key worker taking overall responsibility and robust coordination between services. We know this is important for every child, but particularly for children with additional needs. Working to consistently ensure that practice is adapted, that reasonable adjustments are being made consistently across police, social work and education and health. Cancelling and moving appointments is difficult for any child, but it's particularly difficult for neurodivergent children who face much higher levels of anxiety and may struggle much more when plans that we have carefully tried to explain to them change. We need to bring a much more robust understanding of autism to our practice. And You know, as practitioners, there are lots of things that we can address, but it's about reasonable adjustments, it's about time, it's about seeing behaviour as communication, it's about tackling negative language and descriptors of these children as a challenge. The child is not the problem, what is happening to the child is the problem. And for frontline managers, we need to listen to this message about going to the ends of the earth. We need to make reasonable adjustments to how we work with potential school breakdown. Education, social work, health, we need to work together to prevent school breakdown, to provide extra time. And we need to do better at gathering data about the needs of these children to assist senior managers in fighting for funding. Do we keep good data? Do we just only count as disabled those with a diagnosis? In a context of very long waiting lists, we need to be much better at counting undiagnosed and understanding how to include them in our figures. We need much better multi-agency training. We need to review our local practice and single agency and multi-agency pathways and guidance. Maybe we need champions for these children. Maybe we need to involve parents in service and policy design. Maybe we need to do much more to ask children about how good our services are at listening to them and their parents. Maybe we need to audit the quality of information sharing around neurodivergent learning disabled children. Maybe we need to review our accessible sex and relationships education. If our kids have been out of school, have they missed those sessions? To what extent do they need to be individually tailored and designed? Most school sex and relationships education will be complex. Does it provide enough slow, broken down social stories adapted to children's individual understanding? How can we tailor that, and how do we use communication strategies that are right for each individual child? I'm going to stop sharing there and just see what Nina's telling me about time. I hope that's okay, Nina.
That's great. Thank you, Sarah. It's really interesting. We've got about 10 minutes for questions. Broadly speaking, your questions are divided into two themes. So one's about prevalence. Are children with additional learning needs and disabilities more susceptible, or is it just that the exploiters are better at targeting children with unmet needs? So are there any sort of patterns around specific children, and would you say that they are targeted more often, the children who don't have additional learning needs? And then the other question is really about how you're going to implement your recommendations.
The prevalence questions are really, really significant. I'm not sure we have enough research data to give a clear answer to that. I think we're extremely concerned. I don't know what you'd say from your research, Nina, but we massively lack big studies that could help us identify prevalence for neurodivergent and learning disabled children across the UK. The Jones et al. Meta-analysis pulled together the learning from lots and lots of different small studies in 2012. And since then, there have been a number of small-scale studies from Australia, from Canada, from Israel, from Turkey, that have all looked, and obviously from our group in the UK, that have all looked, but they're small scale. We haven't got any major data prevalence studies. The funding has not been there, and we desperately need a longitudinal study that could look at disabled children's experiences of harm across all forms of abuse, not just sexual abuse. So we do have enough small studies to indicate that this group do face much higher risks, and that when there is harm to them, it is more harsh. We don't have enough studies, and I don't know if there have been any of the perpetrators of this group of children to specifically know whether they target them more. But I think we're very, very clear that their online safety is as much of an issue as their in-person safety, and that what disabled children themselves tell us, and we've seen this across a number of studies. I did a piece of work on learning disability and domestic abuse. We've had a number of studies with parents. They're all small scale. We've done a bunch of studies looking at sexual exploitation. They've all indicated that children don't necessarily have a good understanding of what abuse is. And for some, they may still see sexual abuse as only as rape, not necessarily understand all the other forms of sexual abuse, may not necessarily get that they have the right to say no to things, may not necessarily understand. And particularly, we could have a whole nother debate about looking at children dependent for intimate care, but to what extent do children have a strong sense that it's my choice who touches my body? To what extent do children with learning disabilities who have been spoken over and for and about all their lives have a strong sense that they will be listened to if they say, no, you can't do that to me, or I don't like that, or I don't want that? What we do know from the systematic review that we did in 2022 under the studies we've done is that these children are consistently more isolated and less heard. They are less consulted about general aspects of their life, their ordinary day-to-day care planning, child and need planning, education planning. They are more spoken over and about. So their voice, as well as their vocabulary, have been grown less well, often. Parents and carers often mean well, but speak for them. And it can often be much more difficult for these children to feel that they can talk about sexual stuff, ask questions. And we know from work we've done with their parents that these parents often have spent so long fighting for services, they're exhausted. They don't necessarily feel that comfortable having conversations about sex and relationships and stuff. And they need more help probably because they've got to be more explicit and break it down more than other parents do. So I think there's a whole variety of research messages that point to the need for greater attention, but there's a massive shortage of research at the same time.
Okay, thank you.
I don't know if that answers the question, Nina, because it's too big, isn't it? When you haven't got the data, it's very, very difficult. When you haven't got the macro data.
Yeah, I mean, we don't know how many children are being exploited per se. Another question, is there a disconnect between the systemic view that children do not need a diagnosis to receive support against the challenge of supporting children, young people, parents, wider systems to better understand the young people's specific needs when a diagnosis is finally received?
Oh God, that's a complicated one. I'm not sure I understand the question, but isn't the important issue to try and work out how is the child affected in their life by what they do and don't seem to understand and can communicate? Is that the issue, that we should start from how the unmet need affects the child's day-to-day life? And yes, once we get a diagnosis, what is the meaning of that for the child's life? But for most of us, particularly as social workers and teachers, nurses working with the child day to day, the issue is, how does this individual child communicate and understand? What are their sensory needs? If I'm trying to talk to this child about a sensitive topic, but they are very distressed and distracted by noise, by sound, by other people, by smells, by my strong perfume or the bright colours I'm wearing, do I not need to listen to what is making that child anxious and adjust that environment so that the child is calm and settled? And then we can do a piece of work and we tailor that to how long they can concentrate for. We tailor it to the vocabulary they understand, and we tailor it to what they need from us. And diagnosis can be massive, it can be an explanation that helps somebody feel better about themselves, but it can also be a label that gets used against them and written in boxes. And the question is, how do we use that diagnosis? The reality, though, in addition to all of that, is this very worrying, troubling stat on a big scale: 2 to 4 years waiting list for speech and language assessments and communication and neurodivergent assessments. We need to think about this because it's causing massive problems. What can we do to speed up those services? I don't know if I've answered that very well, Nina, because I didn't fully understand the whole question.
That's wonderful, thank you. Sarah, thank you very much for your time. It's been really interesting.
I hope it was useful. And my doctoral research is looking at communication between social workers and police during Section 47 inquiries about abuse and exploitation. If anybody would be interested in taking part or like to know more about it, please contact me, because I'm at the recruitment stage, and every researcher knows how difficult that is, because practitioners are very busy. But without research data, it's very hard to argue for funding for services. So it's been lovely to work with you this morning, and I hope that's been useful. And I'm very happy to carry on the conversation via email with people who want to know more. Thank you.
It's wonderful. Thank you.